Hi, my name's Jen from Jennifer Green Health and Wellness, and welcome to Conversations with Jen. March is Endometriosis Awareness Month, and this morning I met with two colleagues of mine to talk all things endometriosis. So if you have endometriosis yourself, or you have a partner, wife or girlfriend with endometriosis, and you'd like to learn a little bit more about what the condition is, take a listen. We have a good chat with my friend Heather about her personal experience with the condition. Thanks for watching.
Hello to everyone that is going to be watching this in the future. As you will have seen from the introduction, we're going to be doing a relatively short talk on endometriosis, given that it is Endometriosis Month, to show you what we can do as a clinic as a whole from a multidisciplinary approach. So I'm just going to introduce us all. My name's Jenny, obviously. I run the clinic, but I'm also an acupuncturist and traditional Chinese medicine practitioner. We've also got Jackie.
Hi.
Jackie is our pelvic health physio, whose speciality is in everything women's health, pelvic health. What she doesn't know is not worth knowing. It's she is our magician in clinic. And then we've got Dalbinder, who is our nutritionist and herbal medicine practitioner, who's going to give us some insight in how nutritional approaches can help with endometriosis first off as well. We will be joined by a friend called Heather at some point, and she's going to be talking about a personal perspective on how endometriosis has affected her life. So I'm going to start off with what is endometriosis. So right from the very beginning, a very sort of layman's term would be that it is the endometrial lining of the womb that is found outside of the womb, but it's not 100% true. So I know that. So I'm going to hand over to Jackie, who's going to just elaborate on that a bit, please.
Okay, hi there. So basically what they've found is they're not quite sure why this happens, but endometrial type tissues, plaques, grow outside the womb, and they can be found anywhere inside that womb, on the fascial tissue, the connective tissue, the organs, the abdominal wall, and they've been found on the diaphragm, lungs. It can be found anywhere, but it's predominantly within the abdominal cavity that it's found. And that endometrial tissue type tissue acts very similar to the endometrium that's inside the womb, so it will be triggered cyclically, but it's got nowhere to go, so it's not got that passage out at like the blood would shed from the womb normally, so that causes inflammation and pain in the abdominal cavity, or where you find them endometrial plaques.
So it does actually bleed. This tissue that is there, not inside your womb, that it could be anywhere in your body, does actually bleed monthly.
Yep.
God, that's horrendous. And I didn't realize that you could find it right up, say, in your lungs.
Yeah.
Nasal cavity as well has been known.
Oof. Okay. Crikey. Okay. So what would be the main signs and symptoms for endometriosis?
So main thing is pain. So this can be, so I think I was listening to a consultant the other day who's a expert in this area, and he said this has been found on children as young as 8 who haven't even started periods. So they think there's definitely an embryological factor to this, that you're born with this going to happen, and it's just triggered over time, and usually that's cyclical. But pain is the main thing that you will find with this, and that's pain in the abdominal cavity. It can be painful periods, really, really painful, debilitating periods. So we're all used to feeling a bit rotten during that time in the month, but with endometriosis you don't just feel rotten, you feel absolutely dreadful, and it can actually stop you going to work, it can actually stop you moving, it has the impact on everything that you can imagine, and you would get bloating, pain with movements, pain with sex, pain on urination, pain opening your bowels. So that's where the pelvic side of things comes in, but pain with movement, definitely. And that can start off just cyclically, but eventually as this disease, because that's what it is, progresses, it becomes more persistent and more chronic, and you get pain right the way through the month.
And I think when from the patients that I've treated with it, it kind of then sort of triggers a whole cascade of other issues, like, for example, on mental health capacity, depression, fatigue, like almost like a chronic fatigue element.
Yeah, huge impact. It ends up being quite a multi-system problem. So where it's gone from plaques growing in one area, as they continue to spread and grow throughout the body and cause these problems, you will get adhesions, inflammation, which will trigger off other problems within the system, and you'll get this central sensitization that everything's, you know, inflamed, and then you can get an immune response, and the fatigue your body's going through, the problems your body's going through. But if you imagine having pain every day of your life, and add to that people not understanding what that is, that's enough to make anybody feel depressed and anxious about going anywhere, doing anything, planning anything. You know, it's quite a significant illness to experience.
Yeah, and hugely undiagnosed, isn't it? Like hugely undiagnosed. You know, what isn't it? Is it 7 to 10 years that the average is these days? Which is just shocking that these women are going through these symptoms and not getting an actual diagnosis. But on that line, to diagnose it is actually not that easy, is it really?
No, so if you were a 15-year-old girl, say for instance, you'd had a 3-year history of periods being really debilitating, they're not going to go straight in, because the gold standard is a laparoscopic procedure, which is a keyhole procedure. But once they get in there, you know, it's quite a big operation, and it can be, because they're having to look around and move things around and things. So they're not going to do that straight away. Excuse me, but that's the gold standard, is laparoscopic, and then they'll take biopsies and do a histological thing, and that's the only definitive way of diagnosis. But obviously, if you take on all the symptoms, and if a patient's listened to and heard, and they're not just looked at as a body part, and the whole story is put together, then, you know, there's a better way of dealing with this initially than 7 to 10 year appointments and, you know, the trauma that causes.
Absolutely. I mean, because I'm going to just quickly mention that on the diagnostic side, I was informed that I had endometriosis on my second C-section, and they were rummaging around in my womb. He was out, and she looked at me and she said, "Oh, you've got endometriosis." And I was like, "Oh, I do. I don't know. I'm not aware of this." And she said, "Yes, it's all over your ovaries." So they've taken a sample, and it came back, you know, yes, you've got endometriosis. And at the time, you know, I would never even classified me as having endometriosis, because I've seen so many ladies in clinic I call them endo warriors, because I just think what they have to go through is just phenomenal. But I look back at sort of from the start of my periods, you know, heavy, painful periods, pain on bowel movements, pain in sex. Along the bowel route, I was eventually diagnosed with IBS. And now I'm kind of thinking, oh, you know, was this endometriosis from the start, and just never kind of like went down that pathway, because it was never really something that I thought of. It's a peculiar thing, really. And I just also, what I want to clarify with you, Jackie, am I right in thinking that you have different grades of endometriosis? So some people might have endometriosis, but with not that much pain, which I would say I'm in that category. But you might have other people who have loads of pain, but not that much endometriosis. And it's all a bit higgledy-piggledy. Or to explain the categories.
So if they do a laparoscopic procedure, they go in and they find a lot of plaques and a D around, that would be classed as grade 3, 4, 5, and they go up in scales. But if they went in and they found small amounts, that doesn't seem to correlate to the amount of symptoms you have.
Yeah.
So some people, it may be found small patches of it, and some people quite a lot. But like yourself, you'd never been that severe that you've gone and sought help and help and help and help. You've just noticed that you've got slight problems in different areas, and when you put them all together, they make a full of picture. And you may have had quite extensive endometriosis, so it doesn't really correlate with how much you've got. It's just that these plaques cause these problems, and that can sensitize other tissues and cause lesions and all the rest. Seems to be the progression along the way.
So treatment wise, what are the treatments open to us, sort of from a NHS perspective, and where you would come in as a pelvic health physio? What's open to women at the moment?
Okay, so if it's a bit of a crazy one, really. So there's a pathway in the NICE guidelines. So if you do have endometriosis or you suspect you do, the NICE guidelines have quite a nice clear pathway of where you can go, what you can do, and what the diagnostic process should be, and therefore what the treatment should be. As far as physio is concerned, there's a NICE guideline for persistent or chronic pelvic pain that suggests physio is one of the treatments in a multidisciplinary approach, but doesn't for endometriosis. Although you get chronic persistent pelvic pain with it. So from physio point of view, we tend to see people in the NHS more for bladder problems. So they'll come in with like bladder urgency, like an overwhelming, I need a wee now, and then not being able to make it to the toilet in time and things like that, or pain with opening their bowels, bowel urgency, or chronic constipation. It can be tends to be one end of the scale or the other. And then, or we get people through who are having a sexual dysfunction, that they're struggling with pain due to sex. By the time we see them, they're pretty far down the line. And, we're lucky in some respects that we have a longer period of time to listen to what this lady is saying to us. And, as they talk and we ask the pertinent questions about bladder, bowel, sexual health, which lots of people don't usually ask, this picture builds up. And if they haven't had a diagnosis of endometriosis, that's where, these things, this jigsaw starts coming to light for us as practitioners, sort of thing. But usually they're coming into me with bladder, bowel, or painful sexual dysfunction.
Wow. And what type of thing is sort of involved in a treatment then? What would, so if someone came to you in clinic with endometriosis, what would be involved in their treatment with you in clinic? Okay,
so again, it would be listening to their story and what problems they have, because it's very individualistic. There's no two ladies that I've seen with this problem who have the same problem, exactly the same problems. It's wide, it's varied, and each person's journey is very individualistic to them and what they experience, problems they experience, and that leads them to having different things that is more important for them to look at. So a lot of people that I'm seeing aren't able to exercise because of pain. And the more they can't exercise, the worse their pain feels, and that affects their mental health and then their weight and, so on and so forth. So we would have a thorough look at how you move. That's, first and foremost. How do you move? Where are your restrictions? Where are the problems? We have a good feel around the abdominal wall and the visceral areas. Some physios, especially pelvic health physios, will be we'll be able to do visceral mobilization, look at scar tissue, things like that. And we would do a sort of pelvic floor assessment as well, which is an internal assessment because that's where the pelvic floor muscles are, internal. And we will be looking at the pelvic floor muscles, the mobility of the urethra, how they work, are they coordinated? Is there increased tone in their muscles? Is there decreased tone in their muscles? Can they move well together? Can they respond? And then we base the treatment on that. Obviously, we always advise on good nutrition because that's it, where Dalbinder comes in, because that is a key point on managing endometriosis. And then you've got all the other therapies alongside that as well, like yourself with your acupuncture and massage and everything, because the tension and stress these ladies are under is immense alongside normal life as well.
Absolutely. So here's a question. So if you know the adhesions that you get, and classically they might join like your womb to your bowel or bladder, in my head I imagine it like chewing gum inside. It's just in my head, that's how I picture it. Physically, from a sort of physiotherapy perspective, are you physically able to loosen everything internally so that in itself is not as congested? Or is it more about getting the muscular system that then surrounds the body? Am I making sense?
Yeah, you are making sense. And that's really hard to say because there's no evidence base to say that what I do with my hands release and mobilize and magically make all this happen. But how you move, the quality of your movement, obviously, if your movement's restricted, so say you've got a carrier bag with a load of apples in and that's it, your abdominal content, and then I pull a part of that carrier bag tight and stiff and everything rolls down, then gets a bit stuck down there, you're going to not want to move in certain ways because that's going to pull every time you do it. So therefore everything's going to shut down and tighten, and you're going to get less blood flow to the area, less mobility, less slide and glide over them organs and different things like that. So what we're doing is teaching you how to move better with less pain, desensitize all them tissues, that central sensitization that's gone on to lockdown to try and protect everything, to calm that down, calm the nervous system down, increase the movement, increase the blood flow and all the rest of it. Therefore, we're not sure we're actually getting rid of them adhesions, but we're just able to move the tissues around it a lot better.
Yeah. So what you've just said is basically how we would come at it, an endometriosis lady from an acupuncture perspective, because to go into sort of how we view endometriosis, it's a total, you've got to flip the way you look at the body. When you come at it from a traditional Chinese medicine perspective, it's just a very different way of looking at it. But we look as, I've often talked about how if we imagine that we are a river and we are flowing, and we've got a river flowing inside us, and if we've got a load of boulders inside and the river stops and it backs up against those boulders and the pressure builds and it creates even more pressure, and then suddenly it will burst through, we've got that erratic movement. So we would say that inside the body, the endometriosis is these boulders, this stagnation, so everything is stuck, which then consequently the whole way you flow, the whole way you move, the whole way you breathe, your digestion becomes stuck. And the points that we would then use are about moving the energy, moving your chi, moving your blood to get you internally flowing, which then makes you flow better mentally. It's quite an interesting thing to do. I'm going to show you, I've forgotten how to do it. He told me how to do this before. There we go. A picture. This is that showing you? Can you see that?
Yes.
Yeah. So this is an example of a lady who we've treated with acupuncture, who with permission, she said, yes, absolutely, share this away. She has had a partial hysterectomy from endometriosis a couple of years ago, and it worked well for a couple of years, and then it returned. And interestingly, it's returned up, kind of more up under her ribs, the pain, very exacerbated with stress, and the lockdown issues of the pandemic exacerbates everything. So you can see where the needles are, which like follows the side of her ribs down. That redness for us from a traditional Chinese medicine perspective is the qi and the blood coming to the surface, and it's moving and it's getting everything circulating well in that area. And she had a fantastic response to treatment. She only had a couple of sessions and it completely went, her symptoms completely went for 6 months. And then she started to creep in again. And then she comes back for these periodic treatments just to kind of keep her maintained. That's not normal. Normally, it is more of an ongoing approach to just helping symptoms ease quite a lot. But I thought that that was just really interesting, the fact that, you know, you can actually see the redness that comes from having the acupuncture needles. And I think where, again, you mentioned before, Jackie, about nutrition, that kind of goes into hand in hand with us as well, because from a Chinese medicine perspective, you know, you are what you eat, to use that phrase. We need to nourish our river. Going back to my river analogy, we need to ensure that we've got qi and we've got blood, and so that you can then function as well as possible. So I'm going to slide over to Dalbinder here, because I kind of think nutrition as a sort of adjunct to treatment for endometriosis is not kind of really commonly, I don't know, I don't think you would actually naturally go there and think, oh, I'm going to seek a nutritionist. But we know as practitioners in a multidisciplinary team that nutrition is huge for treating a whole host of complex problems. So Dalbinder, over to you. How would we help endometriosis ladies through nutrition?
Okay. Hi. So first of all, exactly what Jackie has said and what you've sort of referred to, it is so multifactorial. So you would look at where a person essentially starts and what their foundation of health and well-being is. And then what I would essentially do is, because it's so difficult to know the causative factors of endometriosis, because the jury's still out. As Jackie said, it's something that they think that starts ectopically, you know, from conception and pregnancy. And this sort of, it's almost, and it's hereditary. There's a lot of family history that's out there. So nutritionally or functional medicine, first of all, we think about the pathophysiology of what we think's going on. And to date, some of the information, as again Jackie touched on, is immune response. It's our immune system not working as it should, essentially, and not recognizing cells where they shouldn't be and where they should be. So several things nutritionally. Obviously, you've got to assess where somebody is, where they come to you. Some people will come with an amazing nutrition profile. Some people will come, you know, you'll get all sorts. But so there's some key factors that I'd look at nutritionally, and especially with endometriosis. So the first thing really would look at is hormone balance. And with sort of endometriosis, as you both know, it's predominantly younger women. And sometimes it's women that have had it for years and lived with it and just thought it's, like you said, IBS, or that's the way periods are, which is absolutely ridiculous. And it's when they're trying to get pregnant that they actually sort of find this. And they also find that when a woman is older, when she's either pregnant or had her children or going through peri and menopause, the endometriosis profile sort of reduces the pain. This isn't always the case, but we're just trying to look at some factors. So we look at balancing hormones through nutrition. And the way that you would balance hormones through nutrition would be looking at your microbiome. So looking at how your bowel function is and how your microbiome, your gut flora is. So it may be looking at high fiber diets, which aren't always possible with a lot of people, because again, with a woman, we're so amazing. We've got these three body systems almost sitting sort of right on top of each other. We've got our bowel, we've got our urinary system, we've got our reproductive system. So anyway, so yes, you'd look at sort of the microbiome, a fiber diet, a high fiber diet, if possible, or introducing people to a high fiber diet. Then you'd also look at immune dysregulation. So I would look at the immune system and the core materials for the immune system. So all of the big sort of antioxidants. Again, we're going back to sort of fruit and vegetables, which, you know, everybody sort of recognizes. Also looking at low fat, because there is some sort of correlation and relationship about fat and the way fat sort of relates to inflammation and our immune system. So it doesn't mean no meat, but it means sort of looking at the omega-3 to 6 ratio. Another key factor for a lot of women is toxic exposure. And we're talking about toxic exposure in the toiletries that we use, in our lifestyle, where we live. But this leads on to detoxification and methylation. And so again, with hormone balance, so we'd really make sure, even if it's something like looking at somebody's homocysteine level, is this woman methylating, detoxifying, getting rid of as many toxins? And that then leads into, is she balancing her hormones? And with estrogen and progesterone, as we know, our body's not sort of often producing too much. Sometimes it's the recirculation, and it's our bowel not getting rid of what it should do. So it's multifactorial. I mean, so initially I'd go to the same processes. I'd look at, is the bowel working properly? Are they detoxifying? Are they having lots of antioxidants? And then if I wish to go sort of herbally, I would then, you know, I'd also look at vitamin D and being an immunomodulator. It's talked about and bandied about so much, but nobody seems to know what they're doing, because now doctors aren't testing you. They're just saying we're all deficient, which, you know, great. But 400 IU, which are the nice guidelines for if you haven't had tests, isn't going to cut it with anybody that's deficient. So there's lots of things. And then herbally, there's some latest research herbally on herbs such as the ECG, the green tea, resveratrol, curcumin, turmeric, chamomile, and one or two other herbs. So it's a lot. And then you would look at, as Jackie and you mentioned, specifically what this person's functional timeline is and what their symptoms are and where they're trying to get to. And it wouldn't be a one size fits all. So there'd be so many sort of areas that you could look at. But yes, I agree. It's because the research really isn't out there at the moment, and nobody, unfortunately, is putting money into food or herbal medicine research. I'm not a conspiracy theorist at all. You know, I believe in everything. Give me everything in the modern 21st century to help me with my issues. But yeah, so there's lots and lots of things. And then, Jackie, something else you mentioned, and Jenny, pain. If somebody is coming along with severe pain, again, nutritionally, we could look at some of their inflammatory pathways and look at omega-3 pathways, look at some of the antioxidants. Can we somehow really, really support that immune system so that some of the pain modulation and some of the pain pathways are supported, like we would with, you know, period pain? And we know that herbal medicine and nutrition is very, very effective with sort of, you know, menstrual pain, although that, you know, endometrial pain can be entirely another conference. Yeah. So there are lots of ways, but you've got to assess where the person's coming from. You've got to rule out anything else that's going on, because the bowel, and then, you know, Adhesions, for example, are not always just endometrial. Jenny, you mentioned sort of, having surgery, etc. And there's even an enzyme, serrapeptidase, that has got some information about how it can support adhesions. So yes, there's lots and lots of ways forward. I think the Endometrial Society now is looking a lot at nutrition, and they're also looking at a lot that these women may be more inclined to autoimmune conditions. And autoimmune conditions, again, very much, let's look at the immune system and how we can modulate, not push the immune system, because that's not the way to do it, but support the immune system to work with the body.
Wow.
I know.
Where do we go with that?
I know. There's some key concepts that you would initially look at in somebody's diet. As you know, immediately, there are some key concepts that you would look at. And a lot of these ladies have spent years and years also researching themselves and seeing what works, and going down, gluten causes me inflammation, it causes me pain. I might try and go down that route, but have they then been tested for celiac? So a lot of women come to you, and they come to me certainly, with lots of clues of what they've tried and where you can then build on that.
That's fascinating, but I didn't realise that there was, and I should realise that a big link with the sort of detoxification element. That's quite an interesting thing that I think, not many people will have thought about looking at, really.
Well, two things there. We're talking about methylation, which, as you know, is the body's detoxification, and we're talking about generally toxic exposure to because these false estrogens or false toxicity sometimes mimic and make our body operate in a way that it shouldn't operate. So if we have a lot of external toxic exposure, those estrogens, they're not estrogens, that they will mimic and work in our body and sort of it's like going down the toxic route. It'll affect our body in ways that we really don't know at the moment. And then if our body isn't methylating properly, which is a very easy test, a homocysteine test is a very easy test, and with a lot of people, unless it's genetic, it's easily modified with B vitamins and support through their diet. So it's twofold, really. But I think these days we don't realize how many chemicals are in our food chain now, how many chemicals are in our every chain, water chain, and how our body has that much more work to do to sort of support. And it's doable, but it's just think about the way forward, and the fact that it's a younger person that generally it's affecting when you look at the demographic.
Fascinating, but also really encouraging when you say this is it's an easily achievable test to do, as just one aspect. There is so much that can be done to support women through all three facets of what we've talked about, from a physical perspective, from a traditional Chinese medicine perspective, through acupuncture, through diet. There is so much that is not used enough, partly because we just don't know about it. We don't talk about the options there. And that is what I was hoping to bring Heather on, but I think she's just sent me a message to say that she's stuck. So I might do a mini interview with her and tag it on perhaps. But to show Heather's story, someone who in her 30s has had a hysterectomy because of the severity of having endometriosis, and this is not uncommon, and it's not right. We need to be opening the conversations and exploring other options about supporting women, which is what I love about our clinic, where we have this multidisciplinary team that we will work with all of our eyes and our hands on a lady, see how we can help. that's all I kind of want to say, really. I think that kind of sums up the 3 different approaches as to how we can help. Is there anything you'd like extra to say, you guys?
Can I just say there's a couple of good books out there. So I think what I've found with the ladies I've come across with endometriosis is knowledge is power, for them to be their own advocate of their own healthcare. And so the more they find out about their body, how it works, and how the disease is affecting them, the better for them. So a couple of nice little places to go is, if they like reading, that's there's the Gynae Geek book by Anita Mitra. She's a gynecologist. So that's anything to do with gynecological, reproductive, urinary, bowel, anything, endometriosis or periods, anything like that. That's a really good basis to start from, to learn what your body as a woman does from that point of view. There's your Amy Stein, Heel Pain, Pelvic Pain. This is really, really friendly, user-friendly. It's got loads of exercises in. She's a physio, so it's my bias, I'm afraid. But yeah, it's really good to read, and most of my patients have enjoyed what's in there. And then Amy Stein and a gynecologist who is an expert in endometriosis. They wrote this book, and this is for patients, but it's really good for practitioners to read as well, because if you're going to treat ladies with this problem, you need to understand it as well. So there's some really good information in them 3 books. And then you've got the Endometriosis UK, Nancy's Nook, or Nancy's Nook, whatever, whichever way you pronounce it. There's so much information out there if you're guided in the right direction. It doesn't have to just be the medical model. There's the social as well.
Yeah, and I think that's the key element, isn't it? Is, inquire. And I will say this now, if anyone who's watching this, inquire. We will always refer to one of our specialists to answer any questions. There are so many different avenues about getting support and treatment, and we always have our conversations open. I'm looking at Heather. Can you hear us?
I can. I don't know if you can hear me.
I can hear you, but we can't see you.
No, I'm in a car. It's not a very pretty background.
Please tell me that you are safe.
I am, of course. I've been rescuing animals all morning, so it's been a bit of a crazy morning. What I'm going to do now, Heather, is I've already told Dalbinder and Jackie, who you've already spoken to, obviously, with Jackie. I just wanted to get a more personal approach, or a personal kind of opinion, I don't know, of the effects of how endometriosis has affected your life. And as I just said briefly before, to have a hysterectomy in your 30s is pretty intense, and a drastic decision to make. So I just wanted to get your opinions really on how endometriosis has affected your life, what the world can be doing better. So tell us a bit about your journey, if you are safe to do so.
Yes, I am. Well, where to start? I think the first thing with it is that it's so overlooked or not understood still, which amazes me and baffles me in modern medicine, that we still having the conversations to try and understand something which, in all kind of basic knowledge, is just basic reproduction of a woman. It just baffles me in that sense, and that it took so many years. So for me, it was lots of pelvic pain, completely erratic periods. I also went hand in hand with polycystic ovaries for me, and so I didn't. Oh, I might be able to. Oh, hang on a minute. You might be able to see me now. There we go. Hi. So for some, I wasn't ticking every box for stuff, according to my doctor, and so things kept getting pushed over for a little bit. And so at very young, I just got shoved on the pill, and when that one didn't work, a different pill, and then a different pill. And I just felt very fobbed off. And a lot of, in hindsight now, I can look at things to do with my mental health and other aspects of my physical health. Now with hindsight, I realise actually was so hormonally being driven by, and I was put on antidepressants at a very young age, which again, I'm very grateful for, and they helped with stuff. But I realise now how hormonal the effects of everything, how encompassing it is to all aspects of my health. It was very hard to get pregnant. Very grateful that I do have 2 little ones. Had to have an emergency section with the first, and then we went for an elective with the second, just because we were already told at the first one the amount of damage internally was, they were amazed I was pregnant. And so by the second one, they said, we're going to have to do something about this at a later date. And I think thankfully, because I had that second section and they made very detailed notes about how basically how awful it was inside, I did manage to get a hysterectomy. Not easily, that's not you know, I'm 37 and I've been battling it since I was 18, so it's not easy, but they understood that actually, although I didn't tick all the boxes, inside was a mess, even on paper, although you know, it shouldn't have been as bad as it was. Inside it was, and that wasn't, you know, a way to live. And yeah, so I had a laparoscopy 18 months ago, in where they tried to see if they could do a clean-up job, as they called it. And it became clear that a clean-up job wasn't going to work. And so in January, I had my hysterectomy, and ovaries out as well, cervix, everything. And it's, okay, apart from my kids, but it's the 3rd best day of my life, I have to say. It is, I can't believe the difference already in my pain, in my mental health. Yes, there's going to be things I need to build up again, but it has been the best thing, honestly, that I've ever done. It really is. And I just think it's a shame that it has to happen, but I think it's an even bigger shame that for some women who are so suffering for so long, that it's pushed away as an option for them. You know, if they're not able to have children, or they don't want to have children, which a lot of people, you know, don't want to, then that should be an option for people more, because I can tell you in 3 months how much it has changed my life already. And this, you know, I need to get my HRT and the different balances back into order. I need to lose a bit more weight and get a bit more active, but I can already feel this is the best my body has felt, my head has felt, and my hormones have felt in so long. Yeah.
It's nice to hear you say that you are in a good, or in a better place now than what you were. That is like fab to hear, that you are happy with your decisions that you've made, even though you're young to make those decisions. I think though what is sad is that you weren't given the options to go down all these other routes that were available to you beforehand. Like what you were saying, you know, for so long you were kind of like passed from pillar to post, and it's not really gotten to the nitty-gritty element of what else is open to you to try, so much so that you know, were ultimately, you know, guided to have your hysterectomy, which is great. You know, and now like what you're kind of like how we've met through clinic, you know, looking at how to help you from now on with moving, you know, and getting you back into movement safely post hysterectomy. So I think that's kind of like eye-opening, really, that so many ladies are kind of have to go down this route so young. So hats off to you.
And we've talked briefly over the last few days about it, of how, with hindsight now, I've realised how much of diet has affected things, in terms of, you know, even just down to sleep, making sure that I'm getting my sleep right can actually, the hormones affect my sleep, but also my sleep affects my hormones, my eating affects my hormones affect my sleep. And the things that I'd never really pieced together before. And, you know, I've got sinusitis at the moment, and I know it's because my hormones are having a flare, and the amount of different responses in the body that I just wasn't aware of before, that I wish I had been, you know, much earlier down the line than just getting thrown different, you know, try this pill or try this combination pill or try, and like that would be the big thing, to try and educate people more in that, yeah, you know, if you do want a hysterectomy at the end, you shouldn't be stopped if you want that, and if you don't want children, then that is your choice. And like I say, for me, this was the best thing. But if this had been addressed 18, 19, 20, I maybe wouldn't be in the situation I'm in now. And also, even if I was, but just having a better understanding of how holistically you need to look at things, you know, as we've talked sometimes about diet food. I say this as a, you know, I've stuffed a chocolate bar down my gob, but it's, you know, thinking out the box and making sure that we look at everything and the importance of all of it as well.
Yeah, we're all human. It's just an experience, Heather. You enjoy your chocolate.
I will.
You deserve it for everything you've been through. Fabulous. Thank you for joining us, Heather, to give a bit more of a personal experience on what it's like to have endo. So thank you, everyone. I hope that's been helpful to those that will be watching. My dog's just about to bark. Perfect timing. I won't edit that out. It's fine. So thank you, everyone. And anyone that's watching, if you do want to get in touch, and we will hopefully just keep these conversations going, because that is ultimately what we need to achieve. Okay, love to all.
Yeah, thank you very much. Bye. Bye.